So we'll start with the ABCD of glaucoma, that is the history taking in glaucoma. So the A stands is thorough history of the patients, B is for the slit lamp biomicroscopy, and what is this? It's not coming in the slide mode, yeah. And then we have corrected IOP measurement, detailed gonioscopy, and evaluation of optic nerve head, and fields and other investigations. But usually, slides, history taking is the most neglected aspect of the glaucoma management. What is the importance of history taking? The history often tells the story if we give it time to unfold. It is the first step of doctor-patient interaction, winning the confidence of the patient and establish the trust. So you know your patient. You should know the age is very important in glaucoma patient because increasing age is the risk factor for glaucoma. Race is also very important because we know that Africans and blacks are more prone to have open angles and Asians are more prone to have angle closure glaucoma. Location is also important because if we see pseudoexfoliation, and this is more in the tropical countries, and so we should know the whole history demographic profile of our patients. This is one of the study which shows that POAG is more in the African group than the Asian groups. Then the symptoms of the patient. We should give time to the patient to tell us their symptoms. Usually patient complains of blurred vision, eye pain, colored halos, and field of vision loss. And the most important is the ocular history. We know myopia is one of the leading risk factor for glaucoma, and in OHT, ocular hypertension study also, this shows that most of the myopic patients, they turned out to be in the POAG patient have a risk of 6 to 12 times folds. Then any history of any VR surgery leading to any secondary glaucoma, history of refractive surgeries leading to our thinner CCT, which lead to the underestimation of the IOP and missing out the patients. Any history of uveitis, which also will, secondly, patient use steroid for a long time, and uveitis patients, they also have like secondary glaucomas. Then trauma history. Sometimes patients say, no, I don't have any trauma history, but you have to ask, like many years ago you have any trauma history, because angle recession glaucoma typically occurs years to decades also after some times. And if patient had a like severe loss of blood, though, they also tend to have the risk of having low tension glaucoma. Then drug history is very important. Steroids in any form, topical, oral, anything they are using, we have to ask them. History of topiramate, we have to ask. SSRIs, selective inhibitors, we have to ask, and antihistamines. Also, sulfur drug history is very important. Sometimes patient taking Diamox can land up and come as angle closure patients. So it's not like Diamox we are giving for the any cure, like for the medical IOP reduction, but patient come present to us in angle closure. So we should ask history of all the sulfur drugs also. Then systemic history is very important. We should ask for hypertension and hypotension both, because both are like risk factors for glaucoma. Diabetes history, thyroid history also, it's important. Asthma history, because sometimes patients taking inhaler for asthma and that leads to steroid-induced glaucoma. Any cardiovascular disease history, because patients taking anticoagulants and like we are opting for any PI procedure also, like then patient bleed. And any history of renal disease, migraine, stroke, or any neurological disease is also very important. And then we have lifestyle and socio-economic histories. Some patients, they said, we drink 3-4 liters of water in the morning. That also, having too much of water at one particular point of time leads to the IOP increase. Then patients who are more prone having emotional stress are more prone to have angle closures glaucoma. And people who blow these instruments, they are having a high IOP increases risk. And the persons doing yoga, basically also, like we should stop that if patient is progressing in spite of having all the IOP control. So we should ask all these history in the patients if patient is progressing in spite of our best treatments. Then family history is very important. Usually the first degree relatives have a 10% increased risk. And the siblings of patients are more at the risk than their parent or child. It is one of the study done at Irvine in which they see that the myelin mutation leads to early onset juvenile and adult onset primary open angle glaucoma in a 6th generation family. So a detailed glaucoma history is essential to detect the population at risk, to prevent the side effects of treatment, and to diagnose and treat glaucoma at an early stage. It is humbling how many second opinions are requested by patients with glaucoma, in truth only to find a clinician who will take time to talk to them. So we should give at least, we should not regret like we would not give that time to the patient and then we miss out something. So a clear vision begins with a clear history. Thank you so much.